One more. I'm trying to be clean. 1, 2.
I got to laugh for miles, 'cause I got hope and smiles.
Hello, everyone. How are you doing? Welcome to Juxtaposition, a podcast for Grays Harbor citizens by Grays Harbor citizens. And we're talking about global issues, local issues, and you. And welcome. My name is Felicia Mullins, your hostess. And today we are talking about healthcare. Healthcare, is it a right? And Washington State. What is Washington State doing to ensure that its citizens are being covered? I am here today with Marianna Everson, who to me is the guru when it comes to healthcare. How are you doing, Marianna?
I'm doing well. Thank you so much.
Excellent. Well, tell us a little bit about yourself.
So I'm a nurse and a mom and the wife of a veteran here in Grays Harbor. I grew up in Montesano, live in Montesano now, and became a nurse in 2011 and got interested in this topic, healthcare as a human right, healthcare, how do we cover everyone, healthcare, why can't I just take care of people when they're here? Why do we have to wait, or why do we have to, give options that are not healthy to people because of their insurance or lack of insurance. So.
And so then you started, just as a profession as a nurse, is that what made you passionate about healthcare? Like what has driven you?
I got somewhat interested in politics in 2015 with the Bernie Sanders campaign and all that idea. And actually, the first time I ever really thought of we could really have healthcare coverage for everyone was when he started talking about it. Because before that, I was kind of distracted by survival, and I'd come to a place in my life where I could actually think outside of surviving, right? I had gotten my degree in nursing. So I didn't even know it was possible. I didn't know that was something that could be done. I hadn't thought about it. I hadn't known. I just thought the way it was going was the way that it was. Right. And then started learning that every other industrialized country on the planet has some sort of universal healthcare system. Everyone else has coverage, and they pay a lot less than we do. And what is that all about? So I started learning more. And then in 2016 or 17, I read a local news story, where it was saying that the healthcare authority could not find an insurance company to cover Grays Harbor on the exchange. Nobody wanted to be the insurer for people who could buy into health insurance. So it was like thousands, tens of thousands of people who wouldn't have any health insurance. What is that all about? So I started reading more and more and more, and I called and wrote to single payer healthcare people. I called and wrote into the Office of the Insurance Commissioner of the state of Washington, or different, DSHS and the Area Agency on Aging, and tried to find out some more information. Right. And then we put on a healthcare information meeting, like a town hall meeting at the South Shore Mall, the Riverside, whatever it's called.
The Riverside Shops.
Riverside, yeah. And the good turnout. People were interested. Everybody wanted to talk about it, and I learned about Whole Washington then. That's the day that I met George Davenport, who's the campaign manager for Whole Washington. She came down and presented their healthcare plan.
Wow.
Soon after that, they asked me to be a part of the steering committee, and then we just kind of have gone from there. We had a ballot initiative in 2017, and we gathered 103,000 signatures with all volunteers, just volunteers, like no paid signature gatherers. It's like unprecedented. Nobody gets that. So we're still at it. Yeah.
Oh man, this is so wonderful. And thank you again for being on. Before we jump into Whole Washington, let us start at a meta level. For instance, let's start with this. Is healthcare really a human right, and why should it be?
Well, I believe healthcare is a human right because all humans need it. So there's certain things in the world that to fulfill our intention as a country for life, liberty, and the pursuit of happiness, there's certain things that should not be for profit. Right. So if we're saying that healthcare is not a human right, that it should be for profit, so that some people can make a whole bunch of money off of it, and it's just a privilege that you get, then we're saying that life is not one of our human rights. We're saying that liberty is not a human right. We're saying that the pursuit of happiness is not a human right. And we're not going to provide for the general welfare of our people in the United States. So for me, that does not say that doctors and nurses deserve to work and not be compensated for their work. Everybody deserves to be compensated for their work.
Exactly.
It's to say that we can create a system where everyone is in, no one is out. The healthcare process has enough funds to pay the doctors, pay the nurses, buy the supplies, keep the lights on, provide world-class care to the people of this country. We can organize it differently and have a better way of caring for each other.
Absolutely. Absolutely. So, and I'm glad that we brought this up, because I know in the greater discussion, especially in this political climate today where it's very divided, it's easy to think that when we're talking about healthcare, we're not putting a human element to it, right? When we're talking about healthcare, we are not thinking about families. We're not thinking about how expensive it is and how it's tough when you're sick and you have the family and all of the constraints, the time constraints, the energy, the resources, the money that really goes into it, that could be really, really, harmed. I mean, people go bankrupt.
Yes.
Right.
So 500,000, 500,000 Americans go bankrupt every year. So that's not 500,000 overall. It's every single year, 500,000 Americans go bankrupt, lose their house, whatever, because of their health care, because they got sick and they couldn't work, or they couldn't work, so they couldn't keep their health care insurance, so they have these humongous exorbitant bills that they just kind of lose everything. And I'm going to give you one example of that, okay? That personal example, like I was in the room example, okay? So I cared for a person who was having a healthcare emergency. They got diagnosed with cancer, okay?
Wow.
This person was not of an advanced age, okay? Maybe my age now, maybe a little bit older, but in that bed said, I don't want you to do anything. I don't want any care. I'm not going to go get treatment. I don't want you to do anything, because I do not want to die and leave my husband bankrupt when I die. So
that's difficult.
I don't know that person. I don't know who that person, where she ended up, or what happened to her after that day that I was caring for her. But I sure hope that she's still here, and I sure hope that she's not bankrupt. Nobody should have to make that choice.
Yes.
Nobody should have to make that choice. When we have this advanced technology, we know how to organize things. We have a system that takes care of people over 65 right now. She wasn't there yet, right? And there's no reason. There's no good reason to me. The only reason that I can see is so that insurance companies, pharmaceutical companies can make a bunch of money. Mm-hmm. That's the only reason I can see. And to me, that's not, their profit is not worth the death of 45,000 people a year in America.
Right. I'm really glad you brought that story up, because I'm a huge person that loves metrics. I love metrics. I like statistics. I like facts. And, when we are talking about America, we talk about America as being an exceptional country, one of the most prosperous countries, one of the most diverse and innovative countries in the world, one of the most democratic countries in the world. So, we think of America number one. But when we're looking at the metrics and how citizens in America fare in comparison to other citizens in other nations, when we're looking at education or pollution or equality or healthcare, America doesn't even hit the top 10 or even the top 15, even the top 20 in some cases. In my mind, if we are the best nation on earth, then yes, why would we force our fellow citizens to have to make a choice between not receiving care and giving a legacy away rather than receiving care and keeping that legacy, for your family? We should not have to, Americans should not have to make that choice, like you said. But what do you think about that? What do you think about healthcare, how America does it, especially in regards to American exceptionalism?
Okay, well, here's the thing is that I'm going to be really real here in my way I speak. But we've been lied to our entire lives and told that we're special or exceptional or, in regards to healthcare, that we have the best healthcare system in the world. Other countries do the same procedures that we do. Other countries invent procedures that we use. Yeah. It's not because of us that the healthcare system, the evolution of healthcare has happened. We're not the only reason. The only thing that we have done is had it for profit. So yeah. People always try to say, well, then why do people from Canada come here to get their healthcare? Well, because they think that if they spend money, then they're getting something extra. But Canada has the same. They have some of their hospitals have better, most of their hospitals have. They're like the innovators in like heart surgeries, and right. They're where people go to learn how to do that, like in different cities in Canada. So it's not how much money you spend to get the care. It's the quality. It's the quality of the care that you get and the quantity, because maybe 20 people can get this procedure done at this fancy hospital and pay millions of dollars for this procedure. But what about the other 20,000 people who need that same procedure but can't get it? So it's kind of like, I have access to buy a Porsche, but I certainly can't afford one. Some people have access to get this heart procedure, but they certainly can't afford to, and that's not right. That's not right. Should not die.
I'm so glad you brought that up, for a couple of reasons, because I think everyone has heard of, well, Canada has long lines or Britain has long lines, I actually have a story about that, and hopefully in a podcast, I'll get to it. But, there's this thing called medical tourism that has expanded. It continues to increase. It's been going on for many, many years. People are actually going to other locations around the world to do basic things. People are looking for pharmaceuticals online from other nations, from even the dark web, and so if America is so exceptional in its healthcare system, then why are we spending on healthcare in other nations?
That's right. That's right. So you can go to Canada and buy a year's worth of insulin for the same prices, less than the same prices you can buy for a month.
Right.
Worth. So if you think of somebody who has type 1 diabetes, type 2 diabetes, has to buy insulin, to live.
Right.
Life, liberty, and this pursuit of happiness, right? Life. To live, they have to have insulin. And our pharmaceutical industry is totally corrupted and totally taking advantage of us and letting people die. They don't care. Just for the bottom line.
The legal cartel, the legal drug cartel.
Yeah, don't even get me started on the opioid. No, don't even get me started on that. That's
well,
whole other podcast. We'll talk.
Right. Hey, we are definitely going to cover a lot of those topics in future episodes of Juxtaposition, and of course we will have you on because definitely the opioid epidemic and just the way the pharmaceutical industry is structured. It's not only intriguing, but there's a lot that needs to be talked about. I don't think the conversation is really circulating amongst citizens, and so I hope to get that going, especially here, places like Grays Harbor. We're a rural community that is finding itself after the logging industry had declined. And in that whole deindustrialization, a lot of, social crises has come out of that. So, of course, Grays Harbor has been hit with opioids and all kinds of issues. And then we have an aging population, of seniors who are low income, who do require these medications but can't afford them or have to rely on heavy subsidies. So, yes, absolutely. We will have that conversation. But I'm going to have to end this first part of our podcast on healthcare with Marianna Everson. When we come back, we are going to actually talk about Washington State's healthcare system. We're going to talk about its public option and what I'm looking forward to hearing from Marianna about whole Washington, universal healthcare. So stick with us. Very soon, we will be right back with part 2 of Juxtaposition Healthcare.